It's been over 4 months since Nigeria confirmed its index case of the coronavirus, and despite several measures to put in place to curb further spread, such as nationwide lockdowns, ban on gatherings, as well as health and safety protocols, COVID-19 across the country has been on the increase. Now, latest available figures from the Nigeria Center for Disease Control has it that Nigeria has recorded 25,694 confirmed cases of COVID-19 with 590 deaths across 35 states, including the Federal Capital Territory. The NCDC maintains that Nigeria is now in the community transmission stage. Now, this stage is of the pandemic's stress is the most dreaded phase because of the rate of spread, and if not curtailed on time, may lead to bigger humanitarian crises. Along with existing sensitization and awareness programs against COVID-19, cultural advocacy such as using song performances, drama, and town criers have been identified as veritable means of conveying COVID-19 messages, particularly in the rural areas which have limited access to digital information channels. Now, how effective will cultural sensitization and awareness campaigns be towards curtailing the spread of COVID-19 in the country? This will form part of our discussions as we discuss culture and COVID-19 awareness on the program. Welcome to Nigeria Today. I'm Dennis Adigmanloye. All right, joining me on the program to discuss Nigeria culture and COVID-19 awareness is Tar Ukop, Artistic Director and Chief Executive Officer, National Troupe of Nigeria. You're very welcome to Nigeria Today.
Thank you. Good evening, Nigerians.
All right, and also joining us is a special advisor to the Director General of the National Orientation Agency, a person of David Akoji. Welcome once again to the program.
Thank you very much, Dennis.
All right, let me come to Comrade Tar first. Almost every country in the world is battling with COVID-19 and doing their level best to curb its spread. How would you, to start with, evaluate the impact of COVID-19 in the country so far?
Well, COVID-19 is simply the acronym for coronavirus, which first manifested in 2019, last year, emanating from supposedly Wuhan in China, from animals, from an animal market. We don't know if that's for real, because there are many theories. Some say it's a rogue scientist who tried to engineer biotechnology or biological weapons to use against their enemies in the advanced countries, and this led to some of the strains escaping from the lab. We don't know. What we know is that there's a pandemic hitting the world now, and it's called coronavirus. And the particular strain that we are facing now is just that it's new as a species. But coronavirus in itself is not new to the world. We had SARS, we had MERS from the Middle East, SARS in the Far East, and today we have corona virus that we simply, in Pidgin we say Koro, which has hit Nigeria and the whole world. So today it's a pandemic, and we're just seeing a recycling, I'll say a centurion type of recycling of corona and pandemics. Remember 1720 was the first bubonic plague that hit the world. A lot of people died, millions died in Europe and some parts of the world. Another 100 years later, in 1820, we had the cholera pandemic, which hit the world again. And in 1918 to 20, another 100 years, we had the Spanish flu. Nigerians lost close to, I'm told, about 10 million casualties in that flu. And today, 100 years later, so is it coincidental that every 100 years we face this devastation. How did we get here? What is the lesson? What are we to do? That's where culture comes in.
All right, we'll talk certainly more about the cultural angle to this pandemic shortly. Let me bring in David Akoji now. And in your opinion, we have seen daily rises of this coronavirus in the country. What, in your view, is leading to these quite alarming increases on a daily basis?
Well, unfortunately, Dennis, we are grappling with the challenge of non-conformance with the protocols for preventing contagion of COVID-19. We're seeing mass disregard for the prevention protocols. Unfortunately, members of the public are going about their business as if we actually do not have a health emergency on our hands. This is unfortunate. It's not helping the fight against the virus, and it's also not helping the authorities who are battling day and night to ensure that we begin to experience a flattening of the curve. The present rise in cases is deeply disturbing. You know, we have also experienced a rise in the number count in terms of the death toll.
Yeah.
You just mentioned it now, over 500 casualties since the virus started, and the numbers are still counting, and these are the ones that we're able to track. So we do have a very serious situation in our hands, and there's need for behavior modification. There's need for change of attitude. There's need for more serious adherence to the prevention protocols of COVID-19. We know that the challenge is not a lack of awareness. You know, there's been several levels of awareness that have happened in different parts of this country. So we need citizens and members of the public to take personal responsibilities for safeguarding themselves from contracting this virus.
Sure. All right, let me come back to Comrade. This point about non-conformist attitude on the part of Nigerians and this sense of this virus doesn't exist. What, in your view, is leading to this mentality that clearly is rife within the shores of Nigeria?
Well, first there is the mystification of science. Political leaders argue from a political space and contradict scientific reasoning and scientific facts. So for the ordinary followers who follow their political leaders or gatekeepers or influencers, they tend to think that if it's religion, they say, my imam said, my pastor said, my priest said, my king said, my senator or my whatever, or my president, somebody said so. And so if there's a contradiction between the narrative for the ordinary person to understand, the mystification comes in. So you find that corona big man disease, naturally, because most pandemics are usually flown from abroad. I told you of the 1720 pandemic, the 1820 pandemic, the 1920 pandemic, and now the almost 2020 pandemic. What is the problem? The public health is the issue. Do the people, have we democratized public health? Have we returned it to the people? I mean, when we were kids, if you had measles, your parents would say, okay, brothers, your brothers and whatever sleep in the same room. So when you contract all at the same time, we see who is able to escape it. So that becomes the immunity level, and you and your brothers are treated, those who have either chickenpox or measles. Now for Nigeria and for most of the world, the developed country created the crisis. They gave us social distances, physical distancing. So Nigeria, happily, the government took control very early. Very early. The lockdown was good. But the challenge, the contradiction was, how do you balance livelihoods from safety-hoods?
All right, let's just move this on now. Obviously, you're a cultural expert. In your view, or what can you tell us about cultural advocacy and how effective this can be in curtailing COVID-19?
Well, my parastatal, the National Troop of Nigeria, is in the Ministry of, domiciled in the Ministry of Information and Culture. And basically, as cultural workers, we interact with the population in groups, in clusters, and communities. Now the corona pandemic is hitting communities. So it's community transmission we are faced with now. It's to intervene and make the people own this process of fighting this public health menace. First, to make them believe and understand that from the point of view of science, this exists. And they can see people dying in their thousands all over the world and within their clusters and their neighborhoods. Secondly, what are the protocols that the government is putting out for people to see that it's important to save your life? First, who is the vehicular transporter of coronavirus? Is a human being. So if the human being is the transporter of this problem, the epidemiological strain is understood from the point of view of science. How do you keep people from staying apart? The 2 meters spacing, which the West said social distancing. There's nothing called social distancing. It's physical distancing. Because social distancing, how do you social distance? It's physically. Yeah. If you are physically distant, the rural people have that advantage because most of them are peasants. So when they wake up in the morning, they all go to their farms and they are busy working at the farms, on their farms. By the time they come home, they are so tired, they eat and sleep off. And they go to sleep till the next day. But in the urban areas where the population is so clustered, how can you have social distancing? So the state itself is, the authorities, the health authorities are faced with this problem. The problem of if we quarantine people for too long, they begin to complain naturally that their livelihoods are threatened. And some say, which one pain pass, not to die of hunger or to die of koro? So the authorities have to balance within this. But in the same instance, we must educate people to take control of how they manage their lives. Using the face mask, some people just don't want to use it. We must find a way of between cajoling and enforcement. Using the face mask, social distancing, washing your hands. As simple as washing your hands. And if you don't have water, it becomes a contradiction. How do I wash my hand if I don't have running water to even drink and I'm told to wash my hand with soap? What are the other methods of cleansing that hygienically we can use? Ash, for instance, put ash in the village setting. Can we say there are other local things that we can use for prevention? So now it is community involvement. Who carries this message to the people? Like I said, there are traditional institutions, youth age grades, town criers, peer groups, women organizations. Use your women. The woman is more likely to stay at home and control the children and make sure they follow those protocols than the man who will say, okay, let me go for a bottle of beer or go take my brukutu somewhere and chat with my fellow men and come back.
Sure.
So it's mobilization.
Correct. All right, we'll continue our discussions very shortly. This is Nigeria Today, and our topic is culture and COVID-19 awareness. Stay with us. We'll be right back after this timeout.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, welcome back. The program is Nigeria Today. If you're just joining us, our topic this evening is culture and COVID-19 awareness with our guests, Comrade Ta Uko, Artistic Director and Chief Executive Officer at the National Troupe of Nigeria, as well as David Akoji, Special Advisor to the DG of the National Orientation Agency. Let me come to you now, Mr. David. Like Comrade said earlier, before the break, many in the rural areas are disconnected from the traditional or the mainstream radio and cell phone coverage, leaving them out of critical COVID-19 sensitization messages. How would the agency intend to use cultural advocacy to reach out to these groups?
This is exactly why at this time we are partnering with the National Troupe of Nigeria. We believe strongly that at this stage of community transmission, culture as a vehicle for citizens' engagement is inevitable. People are more receptive when you relate to them in accordance with the nuances of their culture. Traditional rulers are considered to be the custodians of culture. People accept your messages if it's spoken in their language, if it's spoken by a person who looks like them. They tend to have more trust. We think that a big percentage of these non-conformance with the prevention protocols and a big percentage of the disbelief that fuels this non-conformance is not disconnected from the fact that people tend sometimes not to be too confident in the sources from which these messages are coming. So, the partnership with the National Troupe of Nigeria is a change in strategy, a value addition. We will go together into various communities using the platforms of community theater, using the platforms of folk music, you know, without necessarily gathering people. That particular note will be sounded, and if indeed there's need for people, a few people to be there, then social distancing would be adhered to, and would ensure that before we begin the dissemination of this information. So at this point of community transmission, we think that culture would play a significant role in the risk communication going forward. And so strategically, National Orientation Agency, having identified this, is leveraging on the strength that the National Troupe of Nigeria would bring to the table in terms of its personnel who are experienced in the area of dance, in the area of drama, in the area of folk music. We will bring all of this to bear on our platforms, our existing platforms, you know, and that synergy will create a more robust messaging platform to communicate the risk that is involved in COVID-19, so as to engender more and higher levels of responsibility on the parts of members of the public and citizens, especially in the rural areas.
All right, it sounds like a good initiative there. Let's get your take, Comrade Tar, on this collaboration you're going to be having with Edaway.
The collaboration is also with the NTA. We are here on your medium now, and the world is seeing us. It's the digital space we also want to explore. The Voice of Nigeria is partnering with us. The National Orientation Agency is partnering with us. As they handle the information dynamics, we call this the community-directed information system. This community-directed information system uses what the locals are already used to. The persuasive area of culture is where we engage those the community believes in. If the imam uses his period in the mosque to preach to people about what to do, his adherents or those who come to that mosque or that the pastor's church will believe in this. But when the religious persons go and say, oh, we're in God's hand, some will say that you go die anyway, whether Kuru come or no come. That's negative information. So we will, through music, folk music, through folk songs, poetry, at a distance. You will soon see us in Abuja and communities. We want this to be a Nigerian attempt to get the population involved in their own method of information and entertainment dissemination. The world will not stop because there is Koro. There must be cultural entertainment, but we'll use the electronic medium, media generally of today. Facebook will be on Facebook, on Twitter, Instagram, on YouTube, on television, so that our folk songs have messages to combat pandemics. And believe me, look at the Bible. Koro is not the first pandemic in the world. In the Bible, there were plagues.
Sure.
In ancient Egypt, Koro was in Egypt. How did they tackle it in your Bible if you are a Christian? Koro was in Egypt. So in different religions, periods of crisis of health, perhaps now what we'll be looking at, what are the potentials of pharmaceutical herbs or plants in our cultures that can be used, so that we don't wait for magical vaccines from America or China or Britain. What are those things that we can invest in? So investing in knowledge, in education, so that the health facilities, now that both the rich and the poor are now here, we have to work here together. If we don't, we all die here. So it's important that we begin to see that culture, the culture of helping each other understand that we depend on each other, the culture of decent and healthy work in the workplace, basic hygiene. Go back to basic hygiene. In my primary school days, even in colonial times, we washed our hands with soap when we went to school. And during break time, before you have your free meals, you still wash your hand. So we had songs. This is the way we wash our hand, wash our hand, wash our hand. This is the way we wash our hands early in the morning. Why did we leave those simple hygiene processes?
We need to bring those practices back.
Yes.
All right. Our time is fast concluding. Let me just bring David back in here briefly. Women groups and unions in rural areas are known to have a strong voice in the various communities. How would you hope to tap into their influence in propagating this COVID-19 message?
This collaboration with the national troop, as has been the case with other citizens engagement and sensitization on COVID-19 that National Orientation Agency has been having, will prioritize engagement with women. Women have significant influence on desired outcomes. You know, women are the ones who look after the family. They are the ones who see the husband and the child early before they go out for the day. They are the ones who also see them as they come back from their respective daily engagements. So women are a critical segment in terms of what we intend to achieve here. And we will engage them in their unions. We will engage them in their women cooperative gatherings. We will engage them in their various associations. And then we will platform these messages as they gather in various places. And as we engage, especially their leadership, respecting, of course, the social distancing protocol and ensuring no one is put at risk. So the bulk of the messages that we'll be doing using this cultural platform in collaboration with the National Troop of Nigeria will prioritize women engagement, because we know that they have a big role since they are serious influencers in our society.
Absolutely. All right, very briefly, Comrade Tao, how would you envisage your efforts to support the federal government in its quest to curb this COVID-19 menace and propagate the message that we are all responsible and we should own this challenge? Just very briefly, please.
Well, foremost, the PTF, the Presidential Task Force, has done a marvelous job, even getting sign language interpreters. The Nigeria Center for Disease Control, marvelous job. I think for we parastatals, the interagency cooperation and coordination we're doing now, it's our only two way of adding to the gamut of platforms put up by the federal government to support the health of Nigerians and bringing Nigeria back to wealth, but healthy wealth. So the national troop through music, dance, communication therapy. I think we should be able to get across to people at the grassroots,
which is the most
communities.
important. Absolutely.
Yes, take responsibility. Know that Koro is real. You go die if you don't follow the things where they tell you to do.
Very well said.
Yes, thank you.
Very well said.
Yeah.
Comrade Ta Uko, Artistic Director, Chief Executive Officer, National Troupe of Nigeria. Thanks very much for being with us and sharing your cultural experience and thoughts and advice with us on Nigeria Today. And thanks also to David Akoji, Special Advisor to the Director General of the National Orientation Agency. Thanks as ever for always being with us on Nigeria Today and sharing your insights.
Thank you very much, Dennis.
All right. And Nigeria Today airs live every weekday for you viewers, which we appreciate your constant patronage. And we will be back again tomorrow for a fresh episode. And remember, you can watch this or any other episode on youtube.com/NTA News 24 Hub. I'm Dennis Adibunloy. Thanks for your time.